Oh, sure. Thank you. Oh, no worries. All right. Yeah, Ray, Ray's going to provide a recap at 3 o'clock. So I kid you not, in some cases, they actually have to FedEx glass slides to an academic medical center to have a colleague or a peer consult to corroborate the diagnosis. That takes time. That's frustrating. Oftentimes, slides get lost, like I said, broken. Remote diagnosis, as I said, can be challenging. And just for an example, that is not a shoebox exactly, but it is a box, and that is a box full of slides. So some of the opportunities are pathology, like radiology, is becoming very digital, which is it's a good thing. There's a number of vendors, Aperio, Leica, which produce, they're called full slide scanners. And what they do is they take an ultra-high resolution scan of a glass slide. In some cases, they can exceed 3 gigabytes per slide. Is that so they're large. I mean, they consume quite a bit of broadband. With crowdsourcing becoming the norm, I think it allows pathology to tighten the diagnostic loop, where a peer consult that could have taken 2 or 3 days doing FedEx overnight can take not even an hour, just through a workflow engine, which we're going to show you. Online education is becoming the norm. Training residents, training foreign physicians online is not only acceptable, it's commonly practiced. An advancement in machine learning and image analysis, as I'll show you in a few examples. So some of the interesting features today are crowdsourcing. So as I told you, Dr. John Tomaszewski in his collection of 30,000 kidney specimens. Although I don't think he'll be uploading all 30,000 one at a time using our contribute feature. What can we upload? It's up to 5 or so, right? Okay, so this is an example of how you would contribute an asset. You pick certain disciplines. You give us asset licensing. So in some cases, a lot of slides are actually, in fact, copyrighted. So if you had the Glengarry kidney cancer specimen, in some cases it's copyrighted. You give us some more metadata to help the librarian figure out how to initially index the asset. And then voila, you're done. So annotations. Annotation is just looking at a slide and drawing out significant features to help aid pathologists in training, other laboratory professionals, and what to look for. Because when I see that, I don't want to tell you what I think, but again, I don't have the trained eye, as they say. So the nice thing about using the Open Annotate tool from TSG is we're able to annotate at multiple zoom levels. So for example, you can see we've annotated 3 different areas in using an ellipse, a square, and now arrows. We're pointing out where a cancerous cell may be. And Ray and I were deciding we still can't tell what, in fact, is different about that group of cells versus any other. But this is a wonder as far as educating people on how to identify certain types of cancer. So curated collections. A lot of physicians, as in business school, are starting to move more towards case-based learning, where they're given certain inputs, demographics, contextual information, family history, medical history, tissue samples, and then they ask the physician to render diagnosis with the known inputs. Is it cancer or is it not? And then they'll test their hypothesis against the real outcomes. So this is an example of our curated collections. They're authored collections based on regions of the body. This is breast pathology. And as you can see, and you can't read that, unfortunately, but on the left, it has a lot of the metadata. 35-year-old female, Caucasian, non-smoker, so on and so forth. For the absolute nerds in the room. So we got Google Glass. Ray was there when it came. It was a seminal moment. And so we actually did a prototype of Google Glass. So one of the other features is you can have personal collections. So here I have 2 collections. One, a graduate lecture, which is common for most academic pathologists, as well as informatics. And right here under options, you can send the collection to glass. And the most challenging part of this presentation was, in fact, getting the screenshots off the Google Glass, just so you know. So as you can see, there's the graduate lecture, and then I can go through the images. Now, unfortunately, the resolution on glass itself isn't high enough to be of use for a pathologist. However, so as I was at a pathologist meeting in Pittsburgh in April, demoing this and talking to some of the pathologists, it's funny to see these gentlemen and women brainstorm, and they came up with a very unique idea for Google Glass, and that was for autopsies, forensic pathologists, because you can't use your hands. You can dictate to Google Glass. You can take pictures with Google Glass by winking, and in a lot of cases, you would need to pull up guidelines or gross specimens. You know, is this the heart? Show me an image of a heart. So we may push that. I don't know. We'll see. Image analysis. So this is an example out of the University, I believe, of Minnesota Medical School, where they used image analysis software to compare radiographical images on the right-hand side with pathology specimens on the left-hand side, to compare and contrast anomalies in both disciplines. And in this case, this is an example of a prostate biopsy pointing out anomalies. So in cases of using image analysis would be obviously to compare radiology to pathology, time-lapsed. So we're not sure what this is, come back in 6 months and we'll do a time-lapse comparison, as well as compared to known anomalies. So in this case, just think of facial recognition software. If anyone has iPhoto, you can identify faces. This is identifying a prostate biopsy, and it's looking for, and the shading is known anomalies. So this is something that we're talking about. This is on the roadmap. This is a roadmap item. So clinical decision support tool, and this is a reverse image search. So I have a biopsy specimen. I'm uploading it, and I want to have it programmatically analyzed against a registry of digital assets to help support my conclusion that it is in fact benign or malignant. A lot of physicians, I don't want to say, there's a lot of trepidation around knowledge systems. Everyone's familiar with IBM Watson. IBM's had a lot of problems pitching Watson to physicians. And the fundamental use case is, I'm a physician. Took me 13 years to become a cardiologist. Watson could go take a hike. So I think the pitch is using tools, knowledge and expert tools to help support their diagnosis or their conclusions. So this is just an example of that. And this is just the definition, Wikipedia keeping me honest. So other possibilities. So this is an article that came out in The Economist in the spring, that as AIDS has become a treatable illness, it can be maintained with a cocktail of drugs. There's been a rapid emergence of incidents and episodes of cancer, specifically in Africa. For example, ASCP sent a team of 5 laboratory professionals, and I want to say 3 pathologists, to Tanzania earlier this year, where they diagnosed a backlog of about 5,000 pap smear slides, 5,000 over 4 days. That's a lot of work. And getting to Tanzania is not an easy odyssey. And the sad story is, in a lot of cases, by the time they got to the individual pap smears, a lot of these patients had perished. And that's unfortunate. So the question is, well, could we just bring the assets to us? Just send high-res images or scanners to places like Tanzania, scan the images, and almost in a crowdsourcing fashion, Uber-esque, if you will, render diagnosis. And there are some small case studies. University of Pennsylvania is doing biopsy reviews for, I want to say, Nigeria. And so this is something that I've kind of brainstormed, I've kind of modeled out, and I'm trying to build, I guess, political capital and financial capital to actually make it happen. And collaborating viewing. So this is, think WebEx, where I'm the esteemed pathologist and I am training resident pathologist, and where I am annotating live in a whiteboard kind of fashion, educating, and then Ray, the younger pathologist, is asking questions, does it incorrectly. No, Ray, you gotta do it the right way. So coaching, and so some of the other issues with, well, the case case-based management, so think workflow, but think patient data. So you have HIPAA issues and you have FDA concerns. So there's challenges in that. Okay, with that, Ray's going to talk to you about the architecture. You want my little...
All right, so I'll just to hit the technical side. So this is basically the high-level architecture for all of the ACPD applications or ACP applications using Alfresco. So obviously you have Alfresco server on SQL Server, and there's the 3 applications on an application server. Obviously the out-of-the-box share, which represents the asset warehouse, the Vault Web interface for the indexing for the doctors, and then ACPedia. Some interesting things outside. There's a homegrown dictionary called PathTerms, which is basically a dictionary of common pathology terms. And so as the doctors index the assets, we leverage PathTerms to try to determine key terms or key medical terms that could be applied to the assets as they're getting indexed. We also have our annotation server. So it's actually a hybrid of an open source project called OpenSlide, which was built specifically to view the specific formats for these full virtual slides, along with our Open annotation tool. The other piece then is we also do is for ACPedia, we actually push the assets out of Alfresco and push the metadata to an external Solr. And that is the primary interface that we use for the consumers to actually search and find all of the assets within Alfresco. Another key piece at the top is our use of AWS, which is pretty unique in itself. So obviously you have users contributing a large amount of assets. You know, one virtual slide could be, as Ron said, 500 to 1 gig in size. And so obviously there is bandwidth concerns, assuming that there are a number of people contributing and crowdsourcing these assets. So instead of actually then uploading onto ACP's infrastructure, we determine the size ahead of time, and if it is past a certain size, we actually upload that asset into an S3 bucket and store the metadata of the location of where it is in S3 within Alfresco. So in Alfresco, we're actually storing, what I call as a contentless object. And then at a later time, the librarian, when they do want to view the asset, can view the metadata that was tagged and then download that asset from S3 to the local PC and then associate it at a later time. So, and just some high, low-level pieces around the Vault Web architecture. So it's a custom application developed on Java Spring MVC. We use Activity to drive the review and approval workflows. We use our Open Annotate tool to do the annotations on top of it. PathTerms, as I already mentioned. And then we authenticate with ASCP's CRM for access to the application. ACPedia is a single-page JavaScript application. Again, it mostly interfaces with an external Solr, but then talks to Alfresco to serve up the images when they look at it. And then that as well is integrated with ACP's CRM tool. So we initially started, maybe just going back really quick, we started with basically building the foundation, configuring Asset Warehouse, developing the Vault Web piece so that doctors could actually index the applications back in 2012, and then this year have been focused mostly on building the ACPD interface with all of its current functionality. So, all right. So I guess I'm going to transition and do a quick demo. This. Or she's exit the president, exit the show. Okay, so I'll do a quick demo of Vault Web. Hopefully, so this is the Vault Web interface. We'll go to the My Boxes. So if I am a, oops. Do you want to log in really quick? Sure.
Incredibly complex password that everyone knows. Ray told you this is a production environment, right? So we can't guarantee anything.
Remember, pathologists do you have to,
Okay, so this is, as we discussed before, this is a primary interface that doctors then index all of the assets that are available, and they're presented with an inbox. So based on their expertise or what discipline they are, they have expertise in, the administrator will assign assets for that group to index assets. So in this case, Ron is an expert in surgical pathology. So there may be a group of doctors, not just a single doctor, that can then go through this queue and claim those assets to index, and then obviously fill out the metadata. And so this is just the indexing screen. You can choose a discipline, and we make this very dynamic. So based on the discipline, we show the forms based on the metadata. So that's dynamic, and then choosing the sample. Methodology, results and findings. All of this is interfacing with the path terms interface. So you can add multiple attributes here, results and findings and comments. You can also annotate. Now in this case, these are TIFF images. And so here you can obviously annotate, circles, add comments to the associated image. All right. So then if we go into ASCpedia, so this is the ASCpedia consumer-driven interface that all the users would use to search assets. So provides faceted search, obviously, so you can filter based on the assets that are in the results to quickly, based on the metadata that's been tagged within Alfresco. What I have here are basically the the virtual slides. So these are the slides that are larger in size. And if I view this image, again, you can see all the metadata that was tagged by the doctors, decide whether it's in a curated collection or not, and then here as well, you have the opportunity to view the annotations that a doctor may have set on that image. And so this is the case where we actually modified this to look very similar to a microscope. So if I wanted to zoom down to 40 or zoom back, you'd be able to do that. And then obviously that's what it's doing is obviously tiling all of the images because these are obviously very large in size. And so you can go into great detail to see the details on the images. So, yes, right here. So here you can see the annotation. Oops. Of what you're seeing. And then if you want to see the comments, again, the doctors stated what that is and what the diagnosis is. So, and they provide notes for all of the different annotations on the slide. All right.
All right, any questions? Oh, I know the answer.
Go ahead. Go ahead.
The answer is no.
No, that was a big discussion. Basically, the library administrator has the final say on all on the approved annotations. So only via Vault Web, the doctors anonymous user, because then, you know, potentially you'd say, oh, that's Dr. You know, Dr. Searing, she should not, that's wrong, you know, she's wrong, I don't trust any of her opinions. So we tried to make sure that that was displayed on the front of the site. In the out-of-the-box tool, we do have the ability to annotate and store who did it, have security elements, but that wasn't the case.
And much to my surprise, so Ray and I did a lot of brainstorming, and then we had a conference call with a few physicians, and we pitched the roadmap, some roadmap ideas. And there was a lot of resistance to any of the social aspects, like commenting on images. I mean, Dr. Feldman was really kind of concerned that there might be residents making CLMs,